Hi.
Hi there.
Hello.
Can you hear me okay?
Yes?
Yeah, and can you also see my screen? Just to
Yep.
check everybody's all good. Perfect. Okay. I'm gonna kick off then. It looks like we've just got a bit of a smaller session, but that's all right. We can chat through things in a lot of detail. So yeah, welcome everyone. Yeah, I'm Vicky. I lead the support team here at Accurix, and yeah, excited to kind of talk you through getting started with Accubook and yeah, kind of how it all works and giving you a bit of a demo. In terms of just a bit of housekeeping, yeah, as I said, I'm just recording the session. Let me know if you want me to pause that at any point, or rather, I didn't share that. But yeah, it just means that I can hopefully share this guide in the future with other users. And yeah, in terms of asking questions, feel free to ask me questions as we go, come off mute or raise a hand, or if you'd rather just type them in the chat, that's also more than fine. And yeah, I'll try and pick those up either as we go or at the end. I'll also make sure we've got time to do some questions at the end if you have them. So yeah, I'll get started just with some quite informal slides. So yeah, just to kind of give you a recap of what Accubook is. Hopefully you know a bit about it, and I think most of the people on this call will be here because you've been kind of activated as a lead practice to start setting up your clinics at an address. But as a kind of step back, so what is Accubook? It's what we hope is a nice simple product to help you with COVID-19 vaccination bookings, largely to help you automate getting patients booked in by sending them all text links to book in themselves rather than having to ring them all up manually. It's all web based, so that's based in like an internet browser that you can access. So unlike our kind of Accurix desktop toolbar that you might be familiar with, this is all based within a browser, even though you do get there via the Accurix toolbar. It's all in a browser. It'll let you create and manage the vaccination clinics and then invite patients to book themselves in. So sending them an SMS link, and it'll also let you book those patients in manually for any patients that you that don't have a mobile number, for instance, or you want to book on their behalf. It'll let you manage those bookings and manage the clinics on the day, so just having a list of patients who are going to come. And it'll also help you do this like across multiple organisations, because we know that a lot of people obviously group together in PCN groupings, for instance. So kind of lots of things on here, but just covering like what I'm going to cover. So I'll demo kind of what it is and how you initially get access and how that's all set up. How you initially set up your delivery site and invite other practices to work with you and setting up the clinics. How you actually invite those patients and book them on their behalf if you need to, and then a bit about sort of appointment management and how to manage different states, and then also on the day how you would manage those patients. So the initial step of how you get Accubook, I think most people here would have done this already, but there's an Accubook sign-up form that we just get you to fill out so that we've got a few details about the kind of procurement side. So the licensing costs are all covered by NHS England, but for the SMS costs, we need an organisation that can be CCG or PCN or a practice to cover the SMS costs temporarily, and then there'll be a pool of a pool where you can claim reimbursement from NHS England for those costs. And any questions on that, we've got our partnerships team on partnerships at Accurix, or any other questions you have about procurement or any costs related to Accurix in general, they're great to ask for. So yeah, after you filled out the sign up form, we switch you on and we drop you an email saying you are switched on as a lead organisation. So this slide talks through like what the kind of standard configuration is for you using Accubook. So this is kind of designed around those initial guidelines that you were given, say, pre-Christmas, where you were told you're going to group into PCNs where there's a lead organisation or a coordinating designated practice. And yeah, you'll have this lead organisation who sets up a delivery site, and you might be working in a PCN where then you'd have other practices in the group who would send their patients to this delivery site that you're running. We can also make it much more flexible than this. So individual practices can just use it for themselves and not invite any other practices and just use it to invite their own patients to. And we can also use it in a way that, these invited organizations can be invited by multiple different delivery sites, multiple different lead practices. So we'll talk through that as we go. As a kind of user, a lead organization, this is you at the top there in gray, you can set up and manage the delivery site and entering its address, and you kind of create the clinics themselves, so what times they'll be running for and how many patients you can handle. And then for all Accurix users in all of the organizations, anybody that you invite, everybody can sort of accept, yes, I want to be part of this delivery site, and then they can upload patient lists to book in and send invitations and manually book patients and see where they're booked in. So let's just give you an idea of like a mental model of how we initially started setting this up, but it can also be a lot more flexible than that in terms of how the groupings are done. So let me walk you through actually getting set up. So yeah, I'm going to take you through what this will look like for you. So I'm actually going to navigate back a little bit. So how most of you will be set up, and I'm hoping I can just quickly bring this up for you, is via your Accurix chain toolbar. Most of you will be users already. So I've got mine up. It isn't actually linked to EMIS at the moment, but how you'd want to get to Accubook by default is just by clicking on your initials and then clicking Manage Practice. So that so far would take you through to this sort of page where if you've got multiple practices, you kind of choose which one. Let me just exit out of that for now, that we're looking at. So for instance, I'm going to talk you through these 2 lead practices today. These other ones on here are some test organizations of ours because I'm on a sort of our test platform. But you'll be taken through to this manage practice page that you might be familiar with, where previously you would have used it to sort of look at your practice users, maybe approve new users if you're an admin or other things. But we've got this extra section at the top, which is for COVID vaccines. And I'll dive into there in a second. If you, for whatever reason, don't have the Accurix toolbar, say you want to go access this on an iPad, if you're wanting to check patients in, everyone can access this page by just following the URL at the top. So mine looks a bit more complicated actually because it's got the word staging in it. But if you were to just get your staff to go to chain.accurix.com, that's the page they want to go to. And either if they're logged in already, it'll take you straight through. So this is actually a kind of live site that I'm a part of. But by default, if you just get your staff to go to this page, it'll prompt them to log in and they can log into their account there. So if for whatever reason they don't have the Accurix toolbar up, that's the way you can also get in. But otherwise, it's what I said about clicking Manage Practice in the toolbar. So now we're here and we'll get set up. So you should find that if I've activated your practices to get be the lead practice for Accubook, you'll see this new section at the top of your Manage Practice page. You'll see this extra section where it's got vaccine sessions, accept delivery site requests, and a dashboard, and I'll walk through those as we go. So where we want to start to get set up is looking at vaccine sessions. So this is where you'll do like all of your setup of the site. And just to be clear as well, like, as I'm talking through this isn't anything, this is all kind of self-serve. There isn't anything that I'm telling you here that you would need to know or as a secret key to unlocking something. But I'm hoping that me talking through it will just mean that it's familiar when you do it for yourselves. But it should all be very like self-serve. So what we do, we clicked it. So we were in my practice and we've clicked vaccine sessions, and I can now set up a delivery site address. So this is the address where your patients are actually going to go to. So I'd recommend just making it nice and clear about where they should actually turn up to get their jab done. I guess for some of you, this might just be the address for your practice, or some of you, it might be a health centre nearby that you're sending people to, or another venue. So let's say I'm sending my patients to the Accurix Village Hall. Let's say that's in King's Cross. I'm sure there are lots of village halls in King's Cross, and I'll not type and I'll put a postcode in there as well, just to make it really clear where the patients should go. N1, A, B, 2, let's say. So yeah, I've set up my address. This is just where I want my patients to actually attend. As I said, this might just be the same as your practice address that you're entering. I'll click create just to sort of finish that. You can change it up until the point the patients are actually booked in to attend, because if you change it after they've booked in for their appointment, that might be a bit confusing for them, having the address change on the messages that they're receiving. So we've set up the address. We now want to set up some like the other practices, or any practices that you want to be able to invite to this site. So please enter the ODS codes of the practices that will be inviting their patients to this delivery site. So by default, this is me. I created a fake ODS code for this practice that I'm in now, which is Vicky's lead practice, 4th of March. So I'm already added. So you might just say, no, I just want my patients to come, so I'll leave it there. But you might also have a neighbouring practice that you're also wanting to bring people in, or be managing this for your PCN. So if that's the case, you just need to enter the ODS codes of any other any other practices that you want to invite patients here. So I've got a neighbouring practice, which again, I've just created one in our system, which is going to have this ODS code. It's all fake sort of test organisations, but you enter that there and search for it. And that said, oh, this is Vicky's invited practice, 4th of March. Yes, that is what I set up. So I can click add. So here, again, I'm just setting up any practices whose patients I want to be able to book into this site. So if you only want that to be you, that's fine to just leave your practice, but you might want to invite quite a few different practices here if you're going to be the lead practice for your whole group. You'll see that this has gone to pending. So I, as the invited practice, need to accept that. So I'm going to navigate back to my list of practices. So I just happen to be a user at this other practice as well. So I can just navigate into here. I just need to refresh for it to come up. So I've now got the section which says accept delivery site requests. So this is the invite that I've just been sent from that delivery site that I just set up. So I've got a pending approval request. Oh yeah, Vicky's lead practice wants me to send my patients here. So once I accept this, all my patients will see the published clinics at that location to book into. Yep, that sounds good. So I can approve that. So anyone that you invite will need to do this step for that to actually come up. I could be a part of multiple delivery sites. So if I, as this invited practice, maybe I've got the Accubook Village Hall that I can send patients to, but there might also be another site that I could also be invited to if another grouping wants me to send my patients there, or I want to be part of multiple. So I could have a whole list of delivery sites. In that case, my patients would see a choice between all of these options to book into. But in this case, we'll keep it simple. For most, it'll just be one site that you're linked into. So yeah, going back to my lead practice, I should now find that, yeah, I've got both of these set up. It's no longer saying pending. So both of these practices can book into my sites. And so now I'll just want to set up what the actual clinic times are. When am I actually running my sessions to vaccinate my patients? So this is a bit different to your sort of typical appointment book. We don't have a kind of calendar view that you would book patients into in that way. We're essentially just creating lots of slots for patients to potentially book into that are available. So we'll start out with the easy bits, which is just coming up with a date. So let's say that I want to invite patients on the 13th of March. So yeah, I can remember what the year is. What time do I want to do that? Well, I'll do it at 9 till 11. What we're going to do from this is just create lots of appointment slots for this time. So even though it's tempting to just say, oh, well, I want to go 9 till 5, we will create appointment slots that are across that whole time. So that would currently mean that there are no sort of breaks in the day. So I would recommend just putting it in smaller slots so that you can manage some breaks. Now here what we need to do is think about the number of patients per hour that I can vaccinate in that time. So here we're just wanting to think about how many patients in total how many patients for each hour here can we process as a practice? So who do I want to turn up? So for instance, if I know that I've got 3 vaccinators, I've got 3 nurses that I know are going to be available to provide the vaccine. So I've got 3 nurses, and each of them can do a vaccine every 5 minutes, a patient every 5 minutes. So if you do the working out, that means, well, each nurse can do 12 patients per hour, and I've got 3 nurses, 3 vaccinators, so that will be 36. So just a little bit of mini mental maths there to just think about how many patients can I do per hour, but hopefully you kind of have a good sense of that rate that you're doing by now. Then we calculate for you the kind of total capacity. So this is just now saying, well, you're running 2 hours and you've said that you can do 36 patients per hour. So in total, you're going to have 72 patients that can book into this session that I've set up. I'm going to choose a vaccine. Choosing the vaccine, this is just for your kind of record keeping. It doesn't actually write to Pinnacle or to Nims, and it doesn't show to the patient, but it's just for you to kind of track which ones you're managing. And you can change it afterwards if your delivery changes. You can then also say which dose this is for. So you could just say, yeah, both. I don't mind if it's a mix of patients booking in here. I just want to get as many patients as I can for whatever dose into there. Or you might say, I only want this to be first dose patients, or I only want this to be second dose patients. So let's say this is for first dose patients only. This is a bit of an extra one. This will just mean you can set something as a hidden clinic if you don't want patients to see it from their link, but you might just want it as a kind of admin only kind of view for you to see. So we'll leave that for now, but if you did want to set something up that was just for you guys to see on your side for your staff booking in and didn't want patients to just freely book into it, that's there. But these are the main ones along here, and just wrapping your head around that patients per hour section. So yeah, with this patients per hour, sorry, I'll go back and recap how that works. So our appointment slots are currently fixed at 10 minutes. And they're not really intended to be, patients that we think that a patient will take 10 minutes. We know that most practices are going a bit faster than that. But the idea behind that is just to spread out the patients across the hour so that they're just coming at a regular rate. And you might be doing them at different at 5-minute cadence, but it's just, we think that, setting a particular minute time slot, if you think you're doing a patient every 3 minutes, giving them like a 3-minute appointment slot can be a bit sort of confusing, and it's just a bit easier to sort of manage that in terms of, we'll do 6 patients in each 10-minute slot, which is the case here. So in this case, where I've said 36 patients per hour, because an hour is 6 10-minute slots, it means that we're just going to give 6 patients in each 10-minute slot. That slot, 10 minutes in each section. So I can then save it, and it will then come up with here. I still haven't set it live, so you can save a few first just to like put it all out and line out your clinics, and then I can set it live when I'm ready for patients to actually book into here. Just a bit of text about who will be able to see this. In this case, we were booking first only, but if patients booking for their second, they'll only be able to see it if it's the right vaccine type, for instance, if it's matching up. So that's the other thing that vaccine type is used for. I can set that live. I can unset it live, unpublish it, and edit it again or delete it. That won't affect any patients that are already booked in, but I can set it live like that. Let's set up another one quickly, just so you can see like a few being booked in. Let's set one up a couple of days later. Let's do an afternoon clinic, and you can kind of put it at whatever times you want. Let's put it at something a bit odd here, and maybe going till. And so you can put anything in there, but it does need to be 10-minute time slots just to account for those 10-minute appointment slots that we're doing. Maybe I can only do 12 patients per hour at the moment, and then do some clever maths on the number of hours that is to figure out the total capacity. Let's say we're doing AstraZeneca, and let's put that in there. And save and set it live. So I've set up a couple of clinics now. Perfect. So this is the initial setup. So you've now basically set up your delivery site. You've got an address, you've got some clinic times that your patients can come to. If I click continue, what it's actually going to do is automatically take me to a next page to start inviting my patients. But just to show you where it's actually taken me, so if we navigate back, I was in vaccine sessions. I went into, at the other site, into the accept delivery site requests to sort of accept those delivery sites. So that's coming down. So the next page we're on is invite patients. So we're ready to invite patients to our appointments that we've just set up. So a couple of ways you can do this to get patients into Accubook in the first place. The main one that we think you'll probably want to be doing is inviting a list of patients. So I'm going to run through that flow, but just so you're aware, if you ever did want to just invite an individual sort of ad hoc onto Accubook, you can also do that through this portal. And by this, you would just individually search for a particular NHS number and date of birth. So there is that mechanism there, but we imagine that most of you will want to upload in bulk, obviously, with a big CSV of patients. So let's do that. Let's get some patients invited to my clinic. So we've got some details here about how to create the CSV. So we're creating an export. Sorry, you'll be creating an export from EMIS or System 1, and we've got some instructions here for how you do that. Creating a CSV with these columns about the patient so that we can upload them. Quite similar, I think, to if you've done things via MJOG or other systems where you're trying to get an export from EMIS or System 1 and then uploading it. So I've in Blue Peter style got one I prepared earlier, and I'm just going to upload that. So this can take just a few minutes. It takes a bit longer on our test platform, because what we're doing here is we do a couple of things. We are checking that you've got slots available and you can upload patients. We're checking against PDS, so the Personal Demographic Service or the spine, for whether these details kind of look right. And you'll see that I'll get a little warning saying, oh, the mobile numbers don't look right. And that's because I've created loads of test patients. So we're checking PDS. We're also checking Nims, so the National Immunisation Management Service, for whether they've got any vaccinations already. So if that patient's already got a vaccination recorded because they've already been through Pinnacle at another practice and had that recorded, then we won't send them an invite for their first vaccine, and you'll see them categorized in a slightly different way. So good question, Doug. Can a CSV file with patient list be uploaded by anybody? It can be uploaded by anyone. So anybody, I'll navigate back and show you after I've done this upload, but any of those invited practices that we uploaded, so I invited a different practice, can upload a CSV, so anybody can invite them, and it doesn't necessarily need to match where the patient is registered. We kind of recommend doing it from whichever practice they are registered at, just to like keep it simple, but yeah, anyone can upload them. So what's happened here, as I said, I was expecting I would get a warning about the mobile numbers not matching PDS. That's because these are all completely fake patients that don't exist. So but if you do get a warning like that, might just be worth having a check. in one patient's record, for instance, just to double check that there hasn't been anything, that you haven't accidentally manipulated that CSV file or deleted a row, something. Great. So yeah, we've broken these into some categories now. So the top two ones that we're interested in because we're looking at first vaccines for these patients. So we've got some in my CSV file which had a mobile number next to them. So these patients had a mobile number, so that means we're going to automatically invite them. These patients will be sent SMS invites with unique booking links. Perfect. We've got some that 2 out of the 5 to manually book. So these patients maybe didn't have any mobile number, so we just didn't have a contact number for them, or they had a different number. I was intending for that actually to be a landline, so have a 0 at the front, but that hasn't worked quite properly in my CSV because I made it myself. But if they had landline numbers, these will be uploaded with the patient, so you've got that on record, but we can't send them a mobile booking link, so you'll just need to book them manually. So it'll be those patients that you do need to call instead. We've also got some stuff about second vaccine. So if some of these patients we had looked up and said, oh no, they've had their first one, they're actually kind of waiting for an invite to their second, or they've had both of their vaccines, so we'll just ignore them. They'll be put in these categories. But anyway, we're focusing on the first vaccine, so these are the categories that we're looking at. So if I click continue, we'll see I can now, so for those 3 patients that we had the mobile numbers for, we're going to actually invite them. So we've got this kind of pre-created message where you can edit the middle bit. We kind of stop you from editing the bit that talks about clicking the link itself, but you can edit some stuff in here if you wanted to add extra information. So if you wanted to add a link to your practice website or to some information that you are giving patients on the vaccine, you can put that in here. We know that a lot of practices kind of have some specific guidance that they've made or they've tailored that they want to put in, so that's why we haven't built it in ourselves, but you can put it in there, or you can say, car park is round the back of the station, or whatever it is. You can edit that. I'm sure putting it a bit more nicely than I have there. And we're going to text those patients. So this is where we actually send those texts. So I'll click to send, and that's fired off. So these mobile numbers will have now received these. These are all fake ones that I've put in. So yeah, now you can see that we've got these patients in these various states. So as we see, these patients, we kind of categorize them according to what we've done with them. So with these ones, we've got that they're in awaiting response first, and I can actually kind of remove all the information in here and try and filter by that. So I could say, well, I only want to look at patients that are in awaiting response first. So I'm only looking at these 3, or I want to look at all of my patients. So here are my 5 patients that I uploaded. So yeah, for these patients that are awaiting response, they've already received their text. So we probably just want to leave that. And when you've done the upload, hopefully you'll just see some of these patients start to tick through to be booked. And I'll show you where they go in a minute. There'll be some patients the ones that didn't have mobile numbers that we need to book manually. So they'll be flagged as to manually book, and you could tick this. So probably what you want to give your admin teams, if you're getting them to run through ringing lots of patients, is to tick to manually book, and we'll flag up these 2 patients. So then what do I do if I've called up Helen and asked her whether she's free for her vaccine? I can book on her behalf, so just clicking that book button. And this that you'll see is like almost exactly identical to what the patient sees when they click the link on their phone. So it's basically just the same thing that you're seeing on their behalf. So I'll say, like, this is the location that you're going to be going to. I can continue to booking, and now I can book into one of those slots that I set up. So you'll see these like line up with what I set up earlier, and can book in there. I see Lorna's raised a hand. Go for it, Lorna.
Vicky, you know where you're manually booking somebody in? If you're the host practice, do you have, and you've had other practices upload their CSV file, do you have to manually book in for all of those other practices, or can they go in and do that?
They can go in and do that. That's a good point, actually. I'll just navigate back briefly. So yeah, if you imagine, I've been at my lead practice and I've uploaded some patients, but if I navigate back to this invited practice that I'd done, they can invite their own patients. So they can upload their lists and they will see exactly the same thing as I do. So they can manually book their own. If they want to, they can untick this box that says like filter to my practice, and they can see mine. So it's just up to you how you choose to see that. But no, you don't have to do it as the lead practice. They can upload their own patients and do their own management.
Okay, phew, thank you.
Yep. So where were we? Yep, so we'd clicked to book Helen, and this has opened this tab for me, and I can see these times to choose from. We basically pick some random appointment times within those slots to display at first. just to try and balance out the kind of flow of patients so that they don't always just pick the first one that's available and book up that way. So we've done that, but they can also click show more options to see like all of the appointments available. So let's say I fancy a Monday afternoon, 3:10. I'm going to click continue, and then I can confirm my booking. So this is exactly what the patient sees on their link as well, or whether you're doing this for them. So expect if you're manually booking, you'd be sort of talking the patient through this on the phone. And I can click confirm booking. And the patient will see this screen as well, and they can access their link again by clicking on it and click manage their appointments. So they could cancel them and go back to rebook, so they can manage that themselves. But I'm going to leave that for now because that's all nicely booked for Helen. And I think I'll just refresh the page and see that Helen has disappeared from we sort of automatically filter the list to these 2 slots because we know that's what practices will want to be looking at. But if I was to filter by the booked first status, Helen's nicely popped in there. So she's booked in for her first appointment. When that appointment comes and goes, she will move from being booked first to then awaiting invite second. So patients have had their first vaccination and need to be invited to their second. So again, appreciate this is quite a lot of information to be piling on. So yeah, hopefully you can kind of have a hunt around and get familiar with it, but just want to be showing you all of those bits and pieces. Couple of hands raised. I think Doug was first.
Sorry, I was late coming into this.
That's
so
all right.
what I wanted to ask was, I believe that I access this through the managed practice on my normal AccuRx link.
Yeah.
Do my receptionists, do they have that button there? How do they go in basically? Because I've not looked at theirs. Yeah,
no problem. So it's a good thing I mentioned it briefly at the start, but it's easy to recap. So good to just reiterate. So everyone will see that their toolbar, they can all access it by, if they do have the AccuRx desktop toolbar, clicking on their initials and then manage practice. So that's the same whether it's you or receptionists. But equally, what I said was you can also just log into just the web page. So you don't have to get through it by the toolbar. You can also just log into chain.accurx.com. So it's worth bookmarking that link or setting it as a bookmark on if you're using like iPads on the day or something like that so that you can access it. My one's a bit different because our test environment is called staging. So that's why my link looks a bit more funny. Brill, I think there was another hand from Shivanji.
Hi there. It was just a quick question. You've got book first appointment when you went to that appointment list. We wanted to run it as book first triage appointment or something before we book them in for an actual appointment. Is it possible to change that instead of saying book first appointment, change it to say book triage or something?
Oh, I see. So you're wanting to triage patients before they come for their vaccine? Is that...
Yeah, to make so we check, whether there's any contraindications on the telephone.
Oh, I see. There isn't currently a built-in way to do this. Like we're all based around just booking them in for their actual, appointment. So I think what you would need to do is just use this to book in people for their actual vaccines, but maybe have a separate mechanism for calling the patients individually for the first one. Like we don't have separate stages for an initial level of triage. I've not heard that one before. That's really interesting. At the moment, this is just covering bookings for the actual vaccines. Sorry about that. Perfect. So we've got Helen booked in, and obviously hoping that the other patients that we've invited by SMS will be getting themselves booked in as well. I said that you can cancel the appointment, so you can also cancel them on her behalf by clicking manage appointments and going through that cancel flow that I showed. What else can we do then? So now we've got this patient booked in, we can go look at these other sections that we're going down. So we're going down this new list of new exciting functionality you've got in the managed practice page. In our booked list page, we can see these clinics that we've set up. So for each of those clinics that I'd arranged, they're kind of shown in this list, and it means that you can manage this from the day. So I can view the clinic. Helen wasn't booked into that one, so we've got nobody in there, but Helen was booked into this one here, so you can see one patient booked and you can see available slots. You can click view clinic. Obviously, usually we'd expect you to have lots more patients, so this would kind of be a nice long list of everybody that was there, but I can see Helen's booking here where she's booked in. On the day, when I have like a whole list of patients here, I can mark them as arrived. And again, this is just kind of for your record keeping so that you can mark patients as they come in and you know who's come. But you're also able to export this. So that will export a whole list of the patients of all of their details that were booked into this clinic, and also have a column for did they arrive, yes or no. So that's what the arrived button will do. So that's how you'd manage them on the day. Oh yeah, another raised hand. Go for it.
Just a quick one. So this doesn't directly book into EMIS, this books onto this platform here.
Correct, yeah. So Accubook is like a completely different booking platform. It doesn't automatically book across to EMIS or any other appointment book. So it's, yeah, it is completely separate.
Okay, and the text that we send out, could we add our triaging questions to that? So is it a long enough message where we could put, have you had any vaccines in the last 7 days? If you meet this criteria, then you can book, or something like that. Is it long enough to do that?
I believe so, yeah. It depends on exactly how much you're putting in, but we allow sort of you to put an extra kind of 300 or 400 characters in. So I suspect you'd be able to either ask a couple of brief questions, or if you had a link to somewhere that was asking those, then that might be more suitable. So yeah, you can edit it to include some extra info.
Okay, thank you.
Perfect. Take it, I can't code an invite back to the patient record. Another really good question. So yeah, so we've talked through all of the ways that the patients are booked in. In terms of coding to the record, what I'm actually going to demo for you is looking at our support center, and I'll show you where it's all recorded. So oh yeah, we're looking at chain.icooks.com. If you go to our website, I've got a nice bookmark here, and any pages as well, like here will take you to help, and here will, yeah, all of these help links take you to our support center, where we've got loads of guides. So I'd always recommend like having a search in here if you need anything. Oh, I've just spotted somebody wanting to raise their hand. I'll just answer the question about the save to record first, and then we can continue. If I search for save to record, we've got an article for Accubook of what we're saving to the record here. So yeah, we don't integrate with EMIS and System 1 in terms of the appointment books or doing anything automatic to take from those patients. But the thing that we do write back is just a couple of SNOMED codes in various situations of yeah, the invitations. So every time we send a text to a patient, we will add the SMS invite sent code, this one here, to that patient's record. Equally, if the patient declines the vaccine, so if they actually confirm that they don't want the vaccine at all, let me just navigate back to one of our patients. So say this is actually me with my name and lots of other fake information. I can decline a patient on their behalf. The patient can also click to say I don't want the vaccine, and we take them through a flow to kind of opt out. So if they have specifically said, I do not want the COVID vaccine, we will code this to the record. So those are the only two things that we kind of put back in EMIS or put back in System 1. Perfect. Yeah, was it Sis? Yeah, saying they're having a bit of trouble raising a hand. Maybe not. Okay, I'm going to plow through. So I have shown you most of it. Like this is the overview of we set up those clinics, set up the address, and we invited another practice if we wanted to. Then we invited some patients via that link, via the uploading the list, and now that we've shown how to invite them. We send some automatic reminders to those patients. So 1 day after and then 2 days after, send them another little reminder saying, you still haven't booked in your vaccine, please book. You can also send them a manual reminder. If you had patients that were hanging around in this list for like a couple of weeks, you could send them one yourself. And also then obviously book them in if you decided to call them up instead to chase them down. You're also able to kind of refresh data from Nims. So we don't let you do this so soon after you've uploaded it, but there may be an option to refresh the latest data from Nims. So that's the National Immunisation Management Service, to check for any latest vaccinations. So if you're about to call this patient, try and book them in, you're like, oh, I'll just check whether they've actually already had their vaccine. Because if they'd had it elsewhere, this will now pop up saying they had their vaccine. We're going to move them to instead being awaiting invites for their second because they've already had a vaccine. Great. Let me just remind myself if there was anything else I was going to talk through in that demo. So talking about cancelling cancelling bookings. Yeah, we can cancel invites. So if needed, we can just cancel the invite of me, and that'll just remove me from the list and not have me on there anymore if you knew that another practice was going to invite that patient instead, for instance. Yeah, and as we said, like, yeah, we can just see the status for those patients, and then I'd monitor them in the booked list page. If you're wanting to, this is a very early version, but if you're wanting to look at overall numbers of like unbooked and booked slots, we have got our first version of a dashboard. At the moment, just adds up the total of the unbooked slots from all of my booked list and how many are booked. So you can kind of just monitor overall how many people are booked in or not. We're looking to add lots more here in terms of monitoring per practice that's been uploading and all that sort of thing. In here. So that's what all of those sections are. Why can we access Accubook training recordings? Good question. I will come back to that because I've got a few last slides to wrap up on. So I think that's basically covered everything that as a kind of overview. There are obviously, some small bits of extra detail that you'll find as you go, but hopefully that's all kind of made clear to you as you're working through. And we've now kind of talked about we've now kind of enabled the ability to invite patients for second vaccines. I don't have that set up with some test patients to go through now, but you should find that patients who are in this category of awaiting second, you'll see a button to invite for second invite. And there are some guides on our support centre of walking through that. But initially, it'd be good to get you set up just to get all sorted with your first vaccines or getting the patients initially uploaded. I'll go back to my last few slides, just talking about a few other things you can kind of get involved with. Oh, if I find that. So yeah, we talked through lots of those different bits and pieces. Oh, that's weird. It seems to be going backwards. Why have I done that? I'd walked back to the demo slide, hadn't I? There we go. So yeah, I showed you briefly that support center that I mentioned. Like, we've got loads and loads of articles written up about what different bits and pieces do. So if there's a message that you see you're not sure on, like, please do just give it a search, or if you want to read up on anything more there. So that's got lots of guides for getting started, and the URL is support.accurix.com. We also have a live chat where my team are answering questions. So if you do get really stuck with something and you're not able to find the answer, just drop us a message. I'm more than happy to help. And support@accurix.com is our email address as well. What other things might you want to look at? So we've got a Facebook group, if anybody's sort of a keen Facebooker or fancies just talking to other users about what's going on. So we've got a group of 5,000 members. So this is actually a post from one of my colleagues, which is talking about a sneak peek of something we're working on, which is our own version of a recording product, which you might be able to use instead of Pinnacle, for instance. So we post ourselves to like ask for feedback and give sneak peeks about new products and things. But it's also a space for users like yourselves to talk to each other about like how you're managing different situations or what you're doing with your patients. So please do go in there if you're interested to kind of hear the latest and see what other staff members are doing. We've got, I already plugged the support center. We've also got recordings of our webinars. So we've got some other webinars and user sessions on our YouTube channel and other training videos as well. So as you've mentioned, getting recordings on that are all in there. So it's got a bit.ly here, which is that link, but also if you just Google YouTube Accurix, you'll find our Accurix YouTube channel. Thank you for joining. I saw at least one more raised hand again. So more than happy to answer any questions for the next sort of 5-10 minutes. Then conscious that you're all very busy at the moment, so don't want to keep you too long. Go ahead.
It's just a quick question. So here you've just got booking appointments for the first appointment. Let's say we just wanted to upload a CSV file and just send a blanket text saying you've been identified as someone who is eligible for the vaccine. Please call this number. Are we able to do that?
So at the moment, rather than like this being a kind of batch messaging system, it's specifically for sending out links to book into these clinic slots. So you'd need to currently use like a different batch messaging system for that. We are launching our own, but that's part of Accurix Plus that you might have heard about. So have a look on our support center for more detail on our batch messaging system. But for now, Accubook is specifically for sending out invitations to book via a link into these clinic sessions that you've set up in that appointment book.
No problem. Thanks.
Cool. No worries.
Sorry, I can't find the raising hand button. I hope
no worries.
Okay, thank you.
Go for it.
Basically, I'm just in front of my screen trying to set up a clinic for the very first time.
Yeah.
And it's asking me, for example, so I'm just a little bit lost in terms of setting up the clinic, because it's asking me session start time, end time, patients per hour. But what if we wanted to add like an hour of lunch break for the clinicians in between?
Yep. So for that, what I'd recommend doing is just setting them up as like separate clinics throughout the day. So at the moment we don't have a way to sort of, at the moment we don't have a way to build in 2 existing times. Oh, I've clicked into another one here, but here's another test session. At the moment, we don't have a way to like build in a lunch break. So one setup here.
I suppose an AM session and a PM session. Then.
Exactly. Yeah. So maybe do a 9 till 12 and a 12:30 till 3 or whatever it is.
So
just to
if
count
we
for
had,
that.
let's say, 4 clinicians going, and each clinician would do, let's say, 10 an hour, so that'd be 40 per hour. Is that how?
Exactly.
Okay.
Yeah, exactly. Spot on. So if you know that you can do 40 patients per hour, you can pop that in there, and it just means that we calculate those number of slots based to get those patients sort of trickling through regularly. So yeah, that's exactly right.
Another question. So if there were, because a couple of patients, let's say the GP consultant, the hospital consultant was to say they're extremely vulnerable and they need a second dose quicker. So we won't fully strictly be doing only first dose. We might have 1 or 2 who might be a second dose. Then is that when I choose both when I'm clicking on the dose when I'm setting the clinic up?
Yeah. If there's cases where you want patients to be able to book in who might be first or might be second, then feel free to do that. Just note that it will make it visible to any patients to book into.
Okay, actually, that probably is not a good idea then.
Yeah.
So maybe we should just manually book the ones who because they're only going to be 1 or 2.
Yeah, that's probably it. And you may need to set up a sort of extra clinic that's for second dose that people will be able to see. But probably worth setting out separately if it's just going to be the odd one.
Okay. Now, last question before I set this up, because obviously I want to play around with it before actually for it to go live. So you know, on this here says hidden clinic. Click on it, and then it says set live and save it. So if I want to just set it up, but like I don't want anybody to see at the moment, is that when I click hidden clinic?
Yeah. So what hidden clinic will do is just mean that that patients won't be able to see it if they click a link to go. So I think if you're doing it for the first time, then how do we go into this? So if you're doing it for the first time, you'll probably need to make something live for your patients to see, because otherwise we don't let you upload a list of patients if there are no clinics available for them to book into. But what that hidden clinic will do is just mean that patients can't book in. They won't see it as an option to book into.
Can I just quickly jump into something on that, if that's okay?
Yeah, of course.
Yeah, just a quick one. So obviously when we go live with it, the patients would only know if it's live. That is when we share the link. So even if we want to do a test run and we put like just a small session, we can just send that among ourselves to check if it's working or not, right?
Yeah, exactly. Yeah, they only know that they can book in once they've received a link and it's linking them to that.
So Asma, answering to your question, basically, it's if you want to give that a try as a trial, just set up like 5 to 6 an hour session, and we can just within our PC and just give it a try if we're able to access the clinic, if that helps.
Yeah, that's probably a good idea. A lot of people have been doing that with their staff members that they know are eligible.
Yeah, thank you very much. Okay.
Perfect. Okay. Well, yeah, it's sort of 1:30. We've been going for about 45 minutes. If you have any questions, as I said, I'd recommend looking at our support centre, and also we have our live chat and our email support at Accurix if you need us, or just reply to any of the emails that you receive from us. They'll all be channeled in. So I'll leave you to it, and thank you so much, and good luck getting set up.
Thanks. And did you say we can access this on your YouTube channel, right?
Yes. Yeah. So I'll make sure this gets uploaded as well. Yeah.
Thanks a lot. Cheers.
Right. Thanks all. Bye.
Take care.
Bye.
Thank you. Bye.
Thank you.
Thank you. Bye.